Hey YouTube friends, do you have lower back pain problems? Are you looking for relief right now, especially something natural that you can do that doesn't involve taking pain medications or visiting the doctor for injections and hopefully avoiding a surgery? Well, I've got for you today 9 natural remedies that you can do for your lower back pain problem. My name is Dr. David Midoff. I'm a specialist physical therapist over at Paso Manual Physical Therapy, and I've been helping out people with back pain problems for years and years now, and we're pretty darn good at it. Now, these tips that I'm about to give you are just a way to calm down the problem so that you can get a decent night's rest, or maybe not take that medicine that you're looking at taking because you're afraid that it's going to upset your stomach or cause some more serious health issues if you keep using it. Or in some of the prescription strength medications, of course, you're concerned about addiction problems or some nasty side effect. So you can use these tips to avoid those situations. And of course, hopefully you can progress your back problem so that it's completely gone and avoid having to take more prescription strength medications or getting an injection, or of course avoiding an unnecessary surgery because you found a natural way to fix it. So let's get into it. Number 1, ice and heat. Ice and heat are so commonly thrown out there, but the way to do it and how to approach it, not everybody explains pretty well. So let me get into that for you. Some people prefer ice and some people prefer heat. If you've never tried either, I recommend starting with ice first. Get a cold pack. You can buy them at the store, like a Walmart or grocery stores often have them as well. They have some gel fluid inside. You stick it in the freezer and you want to put that on your back. Oftentimes they're very moldable, and that works so that you can contour it to your back. You can kind of lay down on it or sit with it in a chair or a couch. And if you don't want to do that, you can just go get some ice cubes in a bag and put it in a Ziploc bag or something, wrap a towel around it so that it's not so cold against your skin, or put it over your clothing so that it's not directly on your skin, and that works pretty well too. Now what you want to do is have it on for about 15 to 20 minutes. Really, you're looking for your skin to get numb. Just when it starts to get numb, that's when you've had the ice on long enough. Take it off for about 15 to 20 minutes and then repeat that 3 or 4 times, where you put it on for 15 or 20 minutes and take it off and then cycle through that 3 or 4 times. And usually doing that, it can reduce the pain, not necessarily take it away, but it can reduce it so that you can get some relief and not feel like you have to take pain medications. Now, if that isn't working for you, you try that once or twice and it just didn't really make a difference, then try heat. And similar thing, they have hot packs that you can buy at the store. There's hot water bottles, those rubber things that you fill up with boiling water, and they're pretty good as well. Or you can make hot packs at home. I've seen people put rice into socks and then you just tie a knot and stick it in the microwave for a couple of minutes and the rice holds heat really well. There's all kinds of options out there if you just Google hot packs or go to the grocery store and ask about it. Well, you put that on your back, and same thing, you can put that on for about 15 to 20 minutes. Just got to be careful that it's not so hot that it's going to burn your skin, because that can literally happen. You can actually get burns on your skin. So be wise about it and don't get your skin burned. That you can typically leave on for a little bit longer, so you can go maybe up to 30 minutes, and oftentimes people get relief that way if they're not responding to the cold very well. And then there are some people out there that don't respond to either. So if you've tried ice and then you've tried heat and you thought didn't make a difference, that's actually normal. Some people out there just don't respond to ice or heat. That's me. It is also related to body part. Sometimes more superficial joints like knees and elbows and hands will allow the ice or the heat to penetrate better, versus the low back's covered in more tissue, more muscle and other tissues. So it may not penetrate as good, and that could also be a factor in the ice or heat not working in case you don't get the relief that you're hoping. Tip number 2, extra pillows at night. If you've got trouble sleeping at night because of this lower back pain problem that you're dealing with, then go get extra pillows, dig some up in your house. Maybe you got throw pillows around in your living room, or go to the store and purchase a pillow, even if it's a cheap pillow that costs you $10 or less. And when you go to lie down, try lying on a side and put that pillow between your knees. Usually that separates your hips enough to get some tension of the muscles off of your lower back. And then another option is when you're lying on your back, if that's how you prefer to sleep, or you find that that's a little more comfortable for your back, slip that same pillow under your knees so that it slightly bends your knees up, so your legs aren't completely straight but they're slightly bent, And you might even try shoving a few pillows under there, 2 or 3 or more, to almost pick up your legs a bit. And that can take some tension off the lower back so that you can sleep more comfortably. And what we hear a lot of times, people take pain medication to go to sleep because they're not getting good sleep and they're waking up miserable in the morning and they're just not themselves and don't treat people too nice. So we want to have you avoid that situation so that you can have great relationships and have a fun time the next day when you wake up after sleeping with a back pain problem. So try those pillow situations out, and I think you'll find that that helps out tremendously. The third tip here, a natural home remedy, is chair support. A lot of people don't really consider the type of chair that they're using, whether it's a kitchen chair at home that they frequently sit in, their couch, their recliner, or if you've got a job and you've got a desk job and you've got a computer chair at work, consider the back support that you've got. Now, ideally, if you've got a back problem, there's other things you need to be doing. This isn't the only solution. You're gonna have to use a combination of all these tips to find the best approach to ease the back pain problem. But consider the backrest that you've got. You want something with a little bit of cushion on it and something that feels supportive when you go to lay back on it. Now, the way to properly use a backrest, a lot of people don't think about this. You've got to slide your butt all the way back into the seat where the seat part, the bottom part of the seat meets the backrest, that corner. Your bottom needs to be in that corner and then recline back. If your bottom isn't in that corner and there's a gap, usually people will kind of slouch a bit and their bottom slides forward, it puts a not good pressure on your lower back and can begin to affect the back gradually over time and can feed into a back problem. So you want to make sure that you slide your bottom all the way to the back of the seat and then lean on the backrest and ideally get some sort of cushion on there. Now, we've had clients that are working from home a lot and they may be at the kitchen table, and so they're using kitchen table chairs that don't have good support. And if that's you, you've got, say, a wooden chair or metal chair or something that's just not got it doesn't have a whole lot of padding, go find a throw pillow at home, or you can also go to the store and find pads that can attach to chairs like that, or just cushions. And what we see some clients find is donut cushions, which are not necessary for a back pain problem. That's more for a tailbone problem. So if you've got pain in the tailbone when you sit and when you put pressure on that spot, if it hurts, then the donut might be a good idea. But if you've got a lower back pain problem, donuts aren't a good thing to sit on, those donut cushions, because you don't need that gap in the middle. You need the cushion against the back, and on the bottom as well would be nice. So try that out at home with the way that you're sitting in chairs. Tip number 4, knees to chest exercise. This is a great go-to exercise to just get some temporary relief, get some pressure taken off your back, and there's a couple different ways to do this. The easiest way is to go to your bed or go find somewhere that you can comfortably lie down, ideally like a couch, some place that has some cushion. The floor might be a little tough, but you could try it out if you feel comfortable doing that. And lie on your back, and then just bring your knees up to your chest and hug your knees with your hands, and with your hands pull your knees towards your chest. In most back pain problems, this is relieving and it can feel pretty good. It can feel like a gentle stretch through the back, and usually it takes off some of the pressure, which can produce some pain. And I would hang out there for several minutes, 3, 4, 5 minutes, up to 10 minutes. After about that, you might get diminishing returns. Now, if lying on your back is uncomfortable because of your specific back problem, you could do this on your side. So pick a side that's comfortable for you, left or right, and then just slide your knees up towards your chest, and same thing, hug your knees and pull them into your chest and get that pressure off your back. And just hanging out there for a while, I'm talking 5 to 10 minutes literally, and you can kind of play with how much pressure you pull with your hands against your chest, your knees towards your chest, and you can let off the pressure and kind of hold it for a little while, 10, 20, 30 seconds, and then let off. And that tends to ease the back pain problem down. Typically, there's a lot of pressures going through the spine, through the discs and the joints and all that. And so lying down and doing this knees to chest motion takes the pressure off, and it can be relieving like that. Tip number 5, hanging. Hanging from a pull-up bar is what I'm talking about. Now, this is my preference to using an inversion table. We get asked about inversion tables all the time because you see them at the stores and they're interesting, hanging upside down, and the concept kind of makes sense, and it actually is beneficial, an inversion table. An inversion table, in case you don't know, is this device where you step into it. It's got a backrest on it, and you hook your ankles into it. It kind of holds onto your ankles, and then it teeter-totters over so that your feet come up and your head goes down, and you're hanging upside down. And the idea is that you're taking pressure off your spine, which is kind of what I was explaining with that knees to chest exercise. But the problem with the inversion table is twofold. You're not really using muscles a whole lot, which is a big deal with getting the best relief for a lower back pain problem. And then the other problem with this is that you're upside down. All that blood rushes to your head. If you've never done it before, you'll find that it's kind of uncomfortable, and you really have to build up your tolerance. And even if you build up your tolerance, you can't really last too long down there upside down. Getting out of those machines can be a little bit challenging sometimes as well, so there's a little bit of a danger factor for some people. If you are about using inversion tables, that's cool, and if it works for you, great. I'm not saying don't do it. Do what works for you, especially if it's getting you off of medications, avoiding injections, and avoiding an unnecessary surgery. But my recommendation is getting a bar to hang from. So they sell these at sporting goods stores all the time, the pull-up bars that you can install into a doorway. With an open door, you kind of put it on the top of the doorway, and it, using the way that it's designed, it just kind of hooks onto the doorway. You don't have to usually install anything. There are some where you will drill into the ceiling or the walls and get it fixated on there, but there's some that you can just hook into place, and they don't require any drilling or any damage to your walls. And what you would do is hang from that pull-up bar, but with your feet touching the ground, or a step stool, somewhere where your feet can touch so you're not completely hanging. Now, if you've got the strength to hang and your doorway is strong enough to support you, you got to consider your weight on the wall and all that stuff so that you're not having an accident because you fell off the pull-up bar, or you ripped a hole in your wall, you ripped the top end of the door down. Then you can hang. You can hang all the way. But while you're hanging there, with your feet touching or not, what you should do is suck in your abs, tighten up those abs, and this is really good work for you, even if you're not there real long. Because think about it, when you suck in those abs, like you're tightening up your abs and you kind of flatten out your back, flatten the arch in your back, you're taking tons of pressure off. Then with your feet dangling, even if your toes are touching a bit, you're taking a lot of the weight off your lower back. And then you reaching up and holding onto that bar stretches out some of the muscles that attach all the way down into the back. There's a muscle called the latissimus dorsi that starts in the lower back, and then it wraps up around the rib cage and goes into the shoulders. The lats muscle is how it's more commonly known. That muscle can contribute to lower back pain problems. So stretching it out in that manner and then firing up the abs is a much more strategic way to take pressure off the lower back, because you can involve some exercise that you can't quite do on an inversion table. So try that out at home. Tip number 6, keep moving. A lot of people take the approach of, well, I'm gonna rest it, I'm gonna take it easy, and what they end up doing is completely stopping exercises, completely stopping their household chores, putting things off until later, doing the absolute minimum movement necessary to rest their back. And it kind of works. They'll flare down, which is good because they're not taking pain medications and all that. But where it can be possibly detrimental is that their muscles are getting weaker and weaker because they've taken so much time off from moving. You need those muscles, certain muscles, to combat a lower back pain problem. So it's a big deal that you keep some activity in those muscles so that you don't lose too much muscle. And you'd be surprised, after just a couple days of minimal movement, muscles start to waste away, or atrophy as we call it in the medical world. Now, what you should think about when you're going into trying to move with a back pain problem, because it might hurt to move, it might hurt to be standing up and moving around, it might hurt to even just be sitting around. Do what you can tolerate. Do what feels okay on your back. Think about lightening up your chores, finding ways to walk around and having a place to sit if your back hurts. Modify what you're doing, but I would keep moving, because oftentimes that movement that you pursue that isn't really aggravating on your back problem, you might actually free up the joints that are stuck if that's part of your problem, or get moving in the areas that aren't moving so that your back pain problem can improve. So it's highly beneficial that you keep moving. If you stay still, you'll waste away those muscles, but also you have a higher propensity for those joints that are potentially stuck, or those other tissues around your back, muscles and tendons that are not moving too good, to get even more stuck, and you want to avoid that situation. Tip number 7, strength training. Strength training is hugely important for solving back problems. Here in the clinic, whenever we have people with back problems, 99% of the time we're moving into some sort of strength training program as we wrap up their treatment plan. And the reason why we do it is because it is usually fixing the root problem of the back pain that they're dealing with. They've typically got a muscle imbalance, people that have back pain problems, and here in the clinic we identify which muscles are out of balance, which ones are weaker, which ones are too strong, and how they're affecting the spine, the lower back. And we have them doing specific strengthening exercises, correcting their form, correcting their technique, making sure they're doing the right amounts, the right volumes of exercise, and not doing too much to aggravate an issue. So if you have found that certain exercises are okay for you to do while you've got your back pain problem, chances are that's going to be a good thing for you. Now, if you go do a strength training exercise that is aggravating your problem, then I would back off and rethink the situation, try something different, or maybe find somebody who knows a little bit more about how to work this out so that you can find the right strengthening exercise to work on the root problem for your lower back pain issue. Here's tip number 8, massage, especially a specialist massage. So, I talked about this being home remedies, and you can get a family member or spouse or somebody to give you a massage on your lower back and other tight areas of your body, places that are stiff, because that's the point of a massage, is to free up stiffness. This can be hugely beneficial in getting you some relief so that you can sleep through the night, or even get a few days where you feel a little bit better. Going to a masseuse that you like, a place that you've been to before if you're into massages, and letting them know where you're stiff and tight, that can make a huge difference in your back pain problem. But if you can find a massage therapist that has handled back pain problems before and knows how to free up stiff muscles and stiff joints, that's probably going to be an ideal for you. So it may even take going a couple times a week or a few times a week, or going consistently weekly for a while, to make sure that you loosen up those muscles and joints enough to get the relief that you're looking for and keep this back pain problem from getting worse. Now, do some research if you're looking for a massage therapist. You might find the right person at a chain massage place, but it might be hit and miss. You generally want to find the person that is recommended, or the person that is confident, the massage therapist is confident in handling a back pain problem. You don't want to just go willy-nilly somewhere. You want to do a little bit of research, find out if they have helped people with back pain problems before, so that you know that your time and money is well spent when going to see that person. Now, keep in mind that a massage alone is not going to solve the whole problem. It's usually just a piece in the process of resolving a lower back pain problem that's chronic and coming back over and over again, or that's stopped you in your tracks. So I wouldn't go into the massage thinking this is going to fix it, and after I get this massage or a few massages, I'll be done with this back problem. It's usually a combination of that massage plus other things that you have to do. Other things that I mentioned on this list are a good place to start, that are an excellent plan so you can fix this lower back pain problem for good. Tip number 9, expert physical therapy. I think that honestly this is probably the first place you should start, especially if this has been a recurring problem for you and it's just getting worse each time it comes on. We see that all the time with clients. They'll come in and say, I've had back pain off and on for a year or more now, and usually I can do this little exercise or use this lotion that helps out, or get a massage, or they'll tell us things that have worked for them in the past, and they'll get over it within a day or two or a week at most. But now that stuff isn't working, and they've had the problem bothering them for weeks now. They're losing sleep, they're unable to enjoy normal things in their life, and they might even be changing in their mood because they're a little more grumpy because they're not sleeping enough and in pain. So if you're having that kind of situation where it's a recurring problem, chances are you're now on the path to developing some sort of arthritis problem, some sort of disc issue, some pinched nerve situation. Sciatica might be developing already, where you're getting pain going down into the leg or even as far down into the foot. And if that problem isn't addressed early on, it can definitely progress into a situation where you might end up visiting the doctor, having to get an MRI, or having to possibly talk to a surgeon and consider the possibility of having a surgery to fix your problem. Either way, whether you're about to have surgery or you're just concerned about preventing that, but your back problem's not really going away either, talking to a specialist, an expert physical therapist, is going to be of huge benefit for you, because as a specialist physical therapist myself, we offer natural ways to fix a back pain problem. We will use a combination of different approaches to make sure that this back pain problem is on track in getting better, so that you're reducing pain medications, reducing the likelihood of visiting the doctor for injections, and definitely staying away from the surgeon's knife, so that you can have a natural, healthy back the rest of your life and enjoy the things that you love. So an expert physical therapist will speed you through this process and give you more certainty that you'll get the outcome that you're looking for, of being able to live your life without this back pain problem. Well, I hope that this video was helpful for you, YouTube friends. If you've got any comments or questions, just drop them below. If you thought that this was helpful for you, please leave us a like. Click on that like button right there that gives us a thumbs up. And then hit the subscribe button over there so that you can get notified anytime we release more helpful information for your health. And another thing, please share this with somebody that you think needs to hear this video, because you never know. People mention that they have back pain problems and may not be making a big deal out of it, but really they're losing sleep over it. They're taking all this pain medication and they just don't want to tell you about all the bad things that are happening in this life. And if they've mentioned it to you or you've seen them, share this video with them. You might change their life and help them avoid taking medications. And if you're looking for more specific exercises, more tips and help for a back pain problem, because you're online right now and you're looking for different ways to solve an issue, or you're helping a loved one out, go to our channel and hit the playlist tab and find all the videos that we've got on back pain problems. You'll find tons of exercises, tons of other resources and helpful tips. Watch some of those videos so that you can learn some specific exercises to do for your back pain problem. I hope you have a wonderful day. Bye-bye.